Hi friends. Today we are going to understanding about the topic is basics of Pacemaker. Myself Vinoli working as a tutor in Tribulum College of Nursing. Let's get on to the video. Introduction. Pacemakers are the electrode devices that can be used to initiate the heartbeat when the heart intrinsic electrical system cannot effectively generate a rate adequate to support cardiac output. Let's see the exact meaning of pacemaker. Pacemaker is an electronic device which is used to place the heart when the normal conduction of pathway is damaged or diseased. Let's see pacemaker components with different body tissues. One is the pulse generator, which is the power source or battery, and the pulse generator is a small metal cases that is contains electronic circuitry with a small computer and a battery that is regulating the impulses sent to the heart. Next one is leads and wires. It is a insulated wire that is connected to the pulse generator on one end with other end placed inside of the heart chambers. And also the leads is to delivering the electrical impulses to the heart. The third one is cathode, which is the negative electrodes. The fourth one is anode, which is the positive electrodes. The final one is the body tissues. So there are four components which is connected to the body tissues. The pulse generator. The contents is batteries that provides the energy for sending electrical impulses to the heart, and the houses of the circuitry that is controlling the pacemaker operation in the body. The leads are insulated wires that are the delivers electrical impulses from the pulse generator to the heart, and also it is works as a sense cardiac depolarization. During the pacing, the impulses is begins in the pulse generator, which is follows through the leads and the cathode, and the stimulating the heart returns to the anode. And the pacemakers or there are two types. One is the unipolar basing systems and the bipolar spacing system. The unipolar basing system is the flows through the tip electrodes, that is cathode, which is stimulating the heart and return the through body fluids and tissues to the anode. Whereas the bipolar spacing system, which is flows through the tip electrodes located at the end of the lead wire, and also which is stimulating the heart muscles and returns to the ring electrodes above to the lead tip. How pacemakers works? A pacemaker consists of a battery and a computerized generator and wires with sensors at their tips, that is called electrodes. The battery powers the generator and the both are surrounded by the thin metal box. So the wires is connected to the generator to the heart. So finally the pacemaker helps monitor and control the heartbeat. The electrodes is to detect the heart's electrical activity and send the data through the wires to the computer in the generator. If heart rhythm is abnormal, the computer will direct at the generator to the send electrical impulses to the heart. So finally, the pulses travel through the wires to the reach out the heart. Four main functions of the pacemakers perform. One is stimulate, capture, sensing, rate responsive spacing. The stimulate is cardiac depolarization, which is sense intrinsic cardiac function and respond to increased metabolic demand by providing rate responsive spacing and also to providing diagnostic information stored by the pacemaker. The capture is the depolarization of the atrium and ventricles in responses to spacing the stimulations. The sensing means which is ability of a device to detect the intrinsic cardiac activity and understand and restricting failures to sense over-sensing to sensitive to activity. The rate responsive spacing means when the need for oxygenated blood increases, the pacemaker ensures that the heart rate increases to provide additional cardiac output. Next, we'll move on to the types of the pacemaker. So we have that there are two types. One is the permanent pacemaker and another one is the temporary pacemaker. Let's see the permanent pacemaker. So the permanent pacemaker is the implanted totally in the body. So power sources is implanted subcutaneously, usually over the pectoral muscles on the patient's non-dominant site. The permanent pacemaker, it has a two chamber. One is a single chamber pacemaker and dual chamber pacemaker. The single chamber pacemaker in this type, only one pacing lead is placed into the chamber of the heart, either the atrium or the ventricle, and this chamber depending on the chamber to be placed and is sensed. The advantages of the single chamber, the implantations of the single lead, only the one single leads only implantations into the heart. Whereas the disadvantages, single ventricular leads does not provide anterior ventricular synchrony. At the same time, single anterior leads does not provide ventricular backup if anterior ventricular contraction is lost. Whereas the dual chamber pacemaker, the viruses are placed into two chambers of the heart. One lead is placed in the atrium and one places in the ventricle, so which is closely resembles that natural pacing of the heart. The benefits of dual chamber spacing is providing the anterior ventricular synchronize, but the single chamber spacing does not provide anterior ventricular synchronize, but this dual chambers can providing the anterior ventricular synchronize, and also the lower incidence of atrial fibrillation and lower risk systemic embolization and strokes, lower incidence of new congestive heart failure, lower mortality and high survival rates. There are two settings are used to ensure the captures. One is amplitude and pulse width. Amplitude is the amount of voltage delivered to the heart by the pacemaker. The amplitude reflects the strength or height of the impulses. The altitude, the impulses must be large enough to cause depolarization. For example, the capture of the heart. The amplitude of the impulses must be sufficient to provide an appropriate spacing safety margins. A rate responsive pacemaker. It has sensors that detect changes in the patient's physical activity and automatically adjust the spacing rate to fulfill the body's metabolic needs. Next, let's see the indications of permanent pacemaker. One is chronic atrial fibrillations with slow ventricular response and hypersensitivity carotid sinus syndrome and fibrosis or sclerotic changes of cardiac conduction system and sick sinus syndrome and tachyarrhythmia and third degree anterior ventricular block. Next, we'll move on to the temporary pacemaker. It is one that has the power source outside of the body. The temporary pacemaker, there are three types. One is transvenous invasive pacemaker, that is endotracheal site, and second one is transthoracic invasive pacing method, that is epicardial spacing, and third one is transcutaneous pacemaker, that is a non-invasive pacing method. Transvenous invasive pacemaker. It consists of lead or leads that are threatened transvenously to right atrium and or right ventricle and attached to external power source. Next one is transthoracic invasive pacing method, that is epicardial spacing, and it is achieved by attaching an arterial and ventricle that attach to epicardium during the heart surgery. The leads are passed through the chest wall and attached to the external power source. Third one is transcutaneous pacemaker, which is the non-invasive pacing method. It is used to provide adequate heart rate and rhythm to the patient in an emergency situation. Let's see the what are the indications of the temporary pacing method. One is maintenance of adequate heart rate and rhythm during the special circumstances such as surgery and post-operative recovery, cardiac catheterization or coronary angioplasty, and the before implantations of the permanent pacemaker as prophylaxis after the open heart surgery and acute anterior myocardial infections with second degree or third degree anterior ventricular block or bundle branch block, and acute inferior myocardial infections with symptomatic bradycardia and anterior ventricular block. Nursing management of the pre-operative care. One is the financial care and psychosocial and physical care. The financial care is explain the procedure and type of the techniques of pacemaker to the patient and explain cost of procedures and hospital stay. Whereas the psychological care explain the process of the pacemaker insertion and reassure the patient. And whereas the physical method is obtain written consent from the patients and from nearest relative and remove the dentures, jewelries and contact lenses and clean and shave the areas and check vital signs like temperature, BP, pulse and respiration. The intraoperative nursing carers check serologies like HIV, HPSG, HCV and other tests and start an IV line with 5% dextrose solutions or normal saline solution, and check the battery in the pulse generator and prepare the emergency cord, the defibrillator and jelly and the ECG monitor and set up all equipments for insertion of the pacemaker. Post-operative care is receiving the patients and patients the comfort position and recover the pacing the parameters, receiving the time and patience of the heart rate, and other routine care is immobilizations of the affected part and keeping the supine position but allow the movement of finger and ankle joint, and monitor the heart rate and rhythm and monitor vital signs and level of consciousness of patient prevention infection and take ECG and X-ray chest and watch for complications. Patient and family teaching method is maintain the follow-up care of the physicians to check the pacemaker site and begin regular pacemaker function checks, and watch for signs of infections at incision site redness, swelling, dressings, and keep incision dry for 1 week after implantation and avoid lifting operative sites above the shoulder level until approved by care provider, and avoid direct blows generated to the large magnets of MRI scan too should be avoided, and the microwave oven offer the safe to use and do not threaten pacemaker functions. So the patient should be taught how to take off the pulse, and they carry the pacemaker information cord at all times. You should be keep it, and the complications like hematoma and pneumothorax and failure to sense or captures and perforations of atrial or ventricular septum, ventricular atrophy and tachycardia, and movement of dislocations of the leads, and cardiac perforations and infections like endocarditis can be seen in the complications after the pacemaker. And coming to the conclusion, a pacemaker is an electronic device that provides the repetitive electrical stimulation to the heart muscles. When the patient's interstitial pacemakers fails to provide the pursuing the rhythm. Thanks for watching. Subscribe our channel.